Welcome, 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 everybody, to another Sunday of When Black Women Gather. My name is Helen Higginbotham. I'm the founder of this organization where we come together as Black women and other members of our community as is necessary, as is today, when we need to have a necessary conversation that involves all of us. And we talk about matters that are relevant to us. Today, we are going to be talking about how are we doing? Are we checking? How are we doing in this time of such uncertainty? Like, are we taking care of ourselves? Are we dealing with, how are we coping with anxiety or depression? Do we even know what it is? Do we know what it looks like? So I have Dr. Bakari Vickerson here, who is out of the Atlanta area, and he's going to talk to us about that. And then following, we have at the end, we're going to close with, and this section is for men and women, although we think of skincare, we just think of women. But Lynnell Peace is here, and she's a Mary Kay sales director, and she's going to talk to us about skincare. So it's all about self-care, so it's all relevant. So Lynn, I'm going to bring you back on when can I call you Dr. Bakari?
That's perfectly fine.
When he's done, and then we'll bring you back on to talk about that. So thank you, Lynn, for coming, and we'll be back to you before the end of the when Dr. Bakari is done. Okay.
Perfect.
Thank you, darling.
Thank you.
Okay. So, I don't know why I just like Dr. Bakari, but I'm going to call you Dr. Vickerson. Dr. Vickerson was referred to me by Adrian McGahee. Thank you, Adrian. He is out of the Atlanta area. He is a psychiatrist, so it won't be me just speculating about what everybody's dealing with. He's a professional. He's going to talk to us about it. Again, he's going to just talk to us about what it is. What does it look like? How do we help each other? How do we recognize it in ourselves? The verbiage I sent you guys out talked about this whole thing about being strong. Black women are strong. Black men are strong. They don't cry. Like, you know what? We're just as human, and we're just like anybody else. So, Dr. Vickerson, thank you so much for coming. I'm going to do a quick bio about who you are. I've already told him that you're from the Atlanta area. And then he will talk to us. Hold off on your questions, please. Please put them in the chat. And we will end with the Q&A. So you will get to talk to him live, but while he's speaking, just give that time to him, please. Dr. Vickerson is a native Atlantan. That's unusual, isn't it, Dr. Vickerson? Most people
Very
down there are
unusual.
transplants.
You're right. 100%.
So he completed his undergrad work at Morehouse, and then he went to that wonderful school that I went to Howard University. I'm not biased, not at all, but he's a Howard grad. He went to the Howard University College of Medicine, where he developed a passion for the field of psychiatry. He completed his psychiatric residency training at Emory School of Medicine, where he served as chief resident. In 2012, he joined the faculty of Morehouse School of Medicine, where he provided community psychiatric services to patients at Grady Memorial Hospital as part of the assertive community treatment team, for which he served as a medical director. In this role, he would visit patients within their living environment and work with a team of clinicians to deliver comprehensive psychiatric services. During home visits, he would often take walks with clients and discuss the importance of nutritious foods and self-care. I hope we're going to talk a little bit about that too. Yeah, that's important. Like, things that we can do that are outside of the medicinal purposes. As a faculty psychiatrist, Dr. Vickerson trained medical students, residents, and physician assistant students. He desired to fully embrace his passion for holistic medicine and completed the Dr. Integrative Medicine Fellowship at the University of Arizona in 2020. He has practiced in the field of psychiatry for over a decade. He has most recently worked with Mindful Health Solutions in Marietta, where he provided cutting-edge innovative treatments such as, I can't even say that, tell me.
Esketamine.
That one. and transcranial magnetic stimulations. In addition to traditional medication management, he is now the sole proprietor of Optimum Life Wellness, where he enjoys helping clients reach their fullest potential with a focus on the mind, body, spirit connection and blend of innovative, holistic, and traditional services. Welcome, welcome, welcome. I that was a mouthful, but I think it was all very interesting. I want to hear a lot about your current services. I'm sure there are people on this. Let me ask you before we get started. People on this call will be calling in from everywhere. Do you do online services or just in person?
I do online services as well as in-person visits.
Okay, wonderful. So on that note, I'm going to, oh, and his father is here with us. Thank you, Mr. Eugene. Thank you for hanging out. His dad is here. Let me give his dad, because look, I know you're a proud father, so let me give you some shine too.
Thank you.
That's his dad, y'all. Anything you want to say, Dad, the proud father?
Not really, just that, obviously, we're very proud of him and appreciate his contribution. So I'm happy to be here. Thank you so much.
Thank you. Thank you for sharing him.
And I
And
like
now
to
my,
say that, I'm sorry, I cut you off, Miss Helen. Yeah.
go ahead.
Well, I like to say that I wouldn't be here, of course, if it wasn't for him, but I owe so much of the foundation and how I see the world uh, to my father. So I'm very grateful that he's here and for everything he's given me.
And while I'm giving props, let me give props. Adrian, you're on film, on camera. Thank you so much for recommending Dr. Vickerson.
Yes, and I told a lot of people at church about it because he's a gem because there aren't that many African American psychiatrists that I know of in this area. I happen to find him because I'm a therapist, but I'm happy that he was able to do this.
Yes. See, it takes a village to make things happen, y'all. So thank
Hmm.
you, Mr. Wilkerson. Thank you, Adrian. And the three of us are going to leave you, Dr. Wilkerson. You are on your own. Thank you so much.
Yeah, thank you. All right, so I like to jump right in now. I'm going to share my screen. Uh, all right, so once again, my name is Dr. Vickerson, and we're going to be talking about mental health in the Black community. Let's see. So this is our agenda for today. We're going to talk about the stigma of mental illness in the Black community, the intergenerational impact of slavery and ongoing racism, how this stress impacts our bodies, thoughts, and emotions. How do we heal? So the majority of today is going to be talking about the healing process. What is burnout? What is depression? We're going to be talking about anxiety, PTSD, have a look at treatment, different forms of treatment, have oral remedies. We're going to talk about magnetic stimulation, ketamine. I provided some resources, and we're going to take questions at the end. So when it comes to attitudes towards seeking mental health services, this is a study, and it shows that 80% of Black Americans were concerned about the stigma associated with mental illness. The study is from 2013. I would like to say that we've come away from this. So this is not as prevalent as before, but it still exists and it's still very important to talk about. So a little bit about the roots of the stigma of mental illness. I have this question here. Is it internalized oppression? Back in the 1800s, doctors thought that African Americans did not have the capacity to experience depression or mental illness. A lot of this was related to a lack of rights, a lack of resources. In many mental institutions at that time, slaves were not allowed for treatment. And then there's also a mistrust of the medical system. There was once a mental illness called drapetomania, which was basically a term which described the reason that Blacks fled from slavery. There was also a history of lobotomies that were given in the early 1800s and into the 1900s for signs of aggression. There was the Tuskegee experiment, which most of us are familiar with. And then there was actually segregation in the American Medical Association. So there's a lot of reason for doubt, some of which we have internalized. I'd like to speak a little bit about trauma of slavery and ongoing racism. Now, the brutality of slavery is, goes without saying, and even that is an understatement. Over 3,500 African Americans died from lynching from 1882 to 1968. These are some other historic events that have happened throughout time. And, I was interested in, exploring more about some of the atrocities that we have experienced in this country. And I was surprised to find this link here in Wikipedia about different African Americans who have been killed by law enforcement throughout the years, even as recent as this year. We also face ongoing stress, racism from today's administration, removal of critical race theory from schools. The list is ongoing. And, this takes me back to when I read the autobiography of Malcolm X. This was maybe one of the first times in which I kind of realized the overwhelming sense of burden on my shoulders. It was, I realized everything that he had gone through, everything that he had to overcome, and for him to be assassinated for his beliefs really was probably the first time that I felt sadness for an extended period of time in my early teens. There's also this term called epigenetics. And what epigenetics is about is the fact that trauma is not something that is experienced by just one group of people. It is something that can be passed down through generations. And the way it's passed down is not that the DNA is actually changed, but is actually that the expression of certain proteins are changed. And so that can make us more likely to experience certain emotions, certain mental illnesses, and actually to experience certain behaviors. I think that this diagram kind of speaks to that. And stress also impacts our body in many different ways. It impacts our cardiovascular system, our immune system, our digestive system. We're going to talk about just how important our digestive system is for our mental health, as well as, our bone density, headaches, and eye pressure. And so this is kind of a cognitive behavioral therapy view of how trauma of slavery and ongoing racism can impact negative thoughts, how those negative thoughts can then impact certain emotions that can be more likely, and how those emotions can actually manifest into unhelpful behaviors and cause the neglecting of self-care. And there are some multi-directional arrows here because it's not just one way, which I think is very important for us to appreciate. So how do we heal? This is what I like to focus on today. How do we start the healing process? This is something that I found interesting, and that is if trauma can be inherited from one generation to the next, then so can love, emotional intelligence, and wisdom. So healing trauma is not just something that helps ourselves, it's something that can help future and past generations as well. And so part of the healing process is about addressing different aspects of health, body, mind, and spirit. I like to focus on the importance of changing our mindset. So that's super important because this is where it all starts. The desire to heal, the desire to be different, and the desire to experience things differently and to have a different impact on the world. And this kind of speaks to that a little bit more. It's all about setting an intention to heal. Once we do that, then, things will come to us that we seek. And so I like to talk first about the importance of healing our bodies. Some important aspects of that include consuming whole foods, limiting processed, fried foods, sugary foods, and sodas. When we consume whole foods, including vegetables and fruits, we actually digest the nutrients that help to protect those plants and fruits from the environment. Our gut is considered our second brain and allows us to absorb the building blocks of the neurotransmitters that help us to feel good. So we have more serotonin receptors in our gut than in our brain. We also digest the building blocks for dopamine and GABA from the foods that we eat. Hydration is super important. So water makes up 60% of our body composition. It helps our brain, once again, to make hormones, neurotransmitters. So water and the nutrients we consume help to make these neurotransmitters such as serotonin, dopamine, and GABA. Water helps to protect our body against shock. It moistens our cell membranes and our organs. It also helps deliver oxygen to different parts of our body and also aids in digestion. This is the free-flowing spring that's in Stewart County, Georgia. Many of us know about this, but this, oftentimes people can ask, well, what's the best type of water? Definitely spring water is one of the best types that we can consume, and this is a free-flowing source. Now I'd like to talk about the importance of sleep. People who experience sleep deprivation, which is when you sleep less than 7 hours consistently, are 4 times more likely to develop depression. Insomnia can cause or worsen mania, which is a part of bipolar disorder. Prolonged insomnia can actually cause hallucinations, and insomnia worsens anxiety. So negative effects of sleep are experienced in all categories of mental illnesses. All categories of mental health disorders. Sleep deprivation also impacts the way we think. It can increase the risk of cancer. It can increase the risk of dementia, actually. Increases the risk of heart disease, diabetes, weight gain. So sleep is super, super important when we're talking about the basic elements of self-care. Poor sleep also impacts our cognitive functioning. So it is really closely related to how dopamine is regulated in our bodies. So that impacts how we concentrate. It can cause a decline in mood. And once again, it can also increase our risk for dementia, and it also impacts our work performance as well. And the quality of our sleep matters too. So if we are experiencing what is called sleep apnea, which is a lack of oxygenation to the brain at night, we are still at risk for dementia, cognitive impairment, and actually increased blood pressure as well. So, you know, as adults, we should at least be getting 7 hours of sleep a night. So we also want to limit sources of stress. That includes decreasing our screen time, limiting social media, and even limiting just the amount of time that we watch the news nowadays. There's always breaking news going on, and watching this around the clock is something that can increase stress, and we have seen how increasing stress impacts our bodies and our emotions. So I like to talk about when to seek help. This is important. Knowing when to seek help can be the biggest strength we can have. Our functioning is, you know, when our functioning is significantly impacted consistently, this can be a sign of the time is now to seek help. That may look like difficulty getting out of bed, difficulty going to work, difficulty just performing some of the basic activities of daily living, such as taking care of our hygiene. And sometimes it's not us who recognizes these changes. Sometimes it's others who are close to us that are the first to notice. So it's important to be open to observations of those who care about us. And then, you know, when we want better for ourselves also. So super important for us to know ourselves so that we can know when it's time to ask for help. What is burnout? This is something that, you know, is interesting because it's not really talked much about in medical school. It's considered a work-related phenomenon, and the basic definition is a state of mental, physical, and emotional exhaustion. So many of us have been here in the past, and I've actually experienced it. And for me, it was a sense of anxiety that I was not able to, anxiety and fatigue that I was not able to push through no matter how hard I pushed myself. And so these are some of the stages of burnout, which I think can be important to keep in mind because it's progressive. And it can start from, you know, issues with self-worth that then cause us to take on more, work longer hours, find ways of rationalizing the reason that we're doing it. It can progress to, you know, feeling disconnected, feeling numb, hopeless, and can even progress to mental or physical collapse. And so how do we reverse this burnout? Shifting our perspective is really super important. And that means that we have to learn how to put ourselves first and to, you know, insist upon self-care. Oftentimes when the word self-care comes up, people will question what that really means. It's highly individual or individual based. So for some, it can be going on a walk for 5 to 10 minutes. It can be enjoying healthy foods. And I put here that it's important to find little ways of practicing self-care. And because oftentimes it doesn't have to be a huge thing that we take on. It can be something as little as walking outside when we have time for a break at work, taking a nap, and improving our sleep hygiene. Sleep hygiene is related to the behavior around the time in which we sleep, which has a lot to do with our sleep quality. So some of those things can be limiting our screen time before sleep, reading something relaxing before bed, and meditation before bed. For those who are interested in learning more about meditation, there's this app called 10% Happier that I've listed here. And so now let's talk a little bit about depression. What is depression? In order for depression to be diagnosed, symptoms have to be present for at least 2 weeks or more. They consist of either feeling sad or a lack of interest in previously pleasurable activities. In the youth, this can be experienced as irritability. There can also be disrupted sleep, either sleeping too much or a lack of sleep. There can be low energy, poor focus. There can also be appetite changes as well. And anxiety. Many of us are familiar with the term anxiety, but what does it mean? So it involves a feeling of nervousness. There's often obsessive thoughts. So these are thoughts that we can't get out of our head that come to us when we're not trying to think about them. It can also be chest tightness experienced with this. Oftentimes, this is something that can actually cause a person to go to the emergency room due to chest tightness. There can be heavy breathing or hyperventilation, sweating. Sometimes this is something that can prevent a person from going outside of their home as well. So we mentioned a little bit about trauma in the beginning, but what is PTSD? PTSD is not only when a person experiences a traumatic event, it's when, this is something that can happen when you are connected to someone who has experienced a traumatic event. So just knowledge of the trauma that they've experienced can cause some of these symptoms. Oftentimes there are intrusive thoughts of the event. This is our brain's way of kind of going into autopilot, so to speak, and helping us to remember things that we want to avoid. There can oftentimes be a disturbance of sleep. Oftentimes there's a feeling of numbness. There can be a decreased ability to experience pleasure. And anxiety can be triggered by thoughts of the event. So oftentimes people can experience anxiety, for example, when they are driving after an automobile accident and are not aware of where this anxiety comes from. And it's oftentimes related to trauma. And so what does treatment look like? I think it's very important to have a physical examination when you are thinking of seeking treatment. Oftentimes, blood work can be a part of this. Certain vitamin deficiencies can lead to depression, anxiety, and make it more likely for other mental illnesses to occur. Vitamin D, B12, and folate deficiency can be part of this. There can also be alterations in our thyroid hormones, which can lead to depression. Also, autoimmune disorders can lead to depression as well. It's important to address substance use when we're thinking about treatment. There is depression that is actually associated with alcohol use. Part of this is because alcohol is a natural depressant. Another part of this is because alcohol disrupts our gut and our gut lining. Marijuana use is important to address, especially when this is done habitually, as well as the use of opiates. Now, I like to talk a little bit about the benefits of psychotherapy. I think that with everything that we have experienced in the history of being in, and also the ongoing stress that we experience to this day, psychotherapy is something that I personally believe we can all benefit from. Psychotherapy teaches healthy communication, conflict resolution skills, helps to strengthen relationships, helps us to cope, reduces symptoms in most cases. It actually can help us to process and to recover from trauma. It can help us to recover from grief, and it can just help us to deal with day-to-day experiences that may be stressful. My thoughts are, because we are always changing as people, that there's always going to be something that is potentially stressful for us to experience. I personally have a therapist, and I see it as just as I see going to the gym. It's something that can also improve our emotional well-being by changing our neurotransmitters such as serotonin and dopamine. It helps to boost self-esteem, can help us to be more confident, and it can help us to learn how to look within. A lot of times we're not challenged to look within, just in communicating with our friends and loved ones. So therapy can be a great platform to strengthen this, which means that it can help us to learn about ourselves, because we all have gaps in our perspective. All right, so forms of treatment include oral remedies, antidepressant medications can be a part of that. Antidepressant medications are gold standard for treating anxiety and depression. Oftentimes they block serotonin receptors. There is a risk of having a decrease in dopamine as a side effect of antidepressant medications. There's also a risk in thoughts of self-harm. This would be something that a person would have awareness of, which is what I like to state whenever I prescribe antidepressant medication. So even though there's a risk of thought of self-harm, a person would still have the awareness of, hey, this is something that I wasn't experiencing before, or maybe I wasn't experiencing it to the extent as what I'm experiencing now. And this is something that Doc and I talked about. I also tell my, often tell my clients to stop their medication if they are experiencing thoughts of self-harm, and to let me know about it. Different supplements can help to treat depression as well. Some of this include mood enhancement supplements. There are certain brands that I can share later. Ashwagandha is oftentimes used to decrease anxiety. Some studies show that lion's mane can help with cognitive benefits and can decrease anxiety as well. Certain vitamins can be helpful to take for treating depression. Vitamin D. I personally think that we should all be taking vitamin D because the optimal range for vitamin D is between 60 and 100 and not just above 30, as traditional doctors will look to see. And with the evolution of our species, we basically are not able to get enough vitamin D from the sun or the foods that we eat nowadays. Now, there are some limitations here. If a person has kidney disease, then they want to limit the amount of vitamin D that they take. Vitamin B12 is a vitamin that we can take that can help to improve our mood and can help to give us energy. I find that people take a lot of vitamin B12, and sometimes this can lead to anxiety in and of itself. Because once the value gets to be above 1,000, it can start to have diminishing returns. Folate is a vitamin. It's vitamin B9. We get it from eating dark green leafy vegetables, also beans and legumes. If we are low in folate, it can cause depression. And there can also be a genetic abnormality that prevents us from having normal levels of folate unless we take folate. Other forms of treatment include magnetic stimulation. This is a form of treatment that I provided while working at Mindful Health Solutions. And the specific form is called transcranial magnetic stimulation. It's FDA approved for treatment-resistant depression since 2008. And what happens is that magnetic pulses are sent to the part of the brain that we found to be responsible for depression. It's also shown to be effective in treating OCD, chronic pain, a treatment mechanism for smoking cessation, substance abuse, and likely more to come because it helps to reset our neural circuits instead of working on specific receptors, which can have side effects such as our experience with medications. There's also ketamine, which blocks NMDA receptors. Now, this is a form of treatment that works very quickly, but there are some logistical challenges to ketamine. Some are that you can't drive until you sleep overnight after you receive treatment. You have to have a ride to and from the treatment center. And the treatment sessions last 2 hours for esketamine. Esketamine is a form of ketamine that is provided in a nasal spray. So it is FDA approved, so insurance will cover treatments. So it's a more controlled form of ketamine. It's slightly different than ketamine. And some of the benefits of ketamine and esketamine are a very quick treatment response. So oftentimes patients will feel significantly better, if not in that same day, definitely within the first 1 to 2 weeks, if they are going to experience improvement. There's often a decrease in suicidality. So there's actually an FDA indication for addressing suicidality from esketamine treatment. It can often decrease anxiety, and it can also treat PTSD symptoms. One of the benefits of ketamine and esketamine that are different from other medications is that it increases BDNF, which is brain-derived neurotrophic factor. And what this chemical does is that it actually helps to make new neuronal connections. So This is part of the reason why this treatment is needed less over time and why it can be very good to experience while doing talk therapy, because it can actually help to make our perspective more flexible and allow for the benefits of talk therapy more readily. These are some resources that I have provided. NAMI is a great resource just in general. NAMI.org is a great website if you want to find out more information about mental health and mental illness in general. They also have categories for different mental illnesses that I did not cover today. There's the suicide prevention hotline. There's also psychologytoday.com where you can really secure a therapist. I like it because you can read their bios. You can also select filters such as the insurance that you may have, whether or not that therapist sees clients in person or telehealth only, whether or not they are actually available. So if you're highly motivated to seek a therapist from today's session, psychologytoday.com is a great place to start. And on the right, there are some resources more specific to the Black community in terms of therapy and other mental health resources. Also, as stated, I have a private practice called Optimum Life Wellness. This is my contact number here. Website is soon to come. And also I collaborate with a nurse practitioner at Psychiatry and Wellness of Georgia. I provided their information here. And at this time, I like to take any questions.
Okay, thank you. There are plenty of questions in the chats.
Okay, great.
Let's see. Should we stop the share?
Yes, we should.
All right. I see one hand is up already. Go ahead, Linford. I'm sorry. First of all, I'm messing up names because I called you Dr. Wilkerson. Forgive me. Did you catch that?
Yes, that's okay.
No, it's not. I apologize. And I'm calling him Linford, and he's my friend. I know his name is definitely
I don't know
Linford, but
why.
because I'm looking at your name. I'm doing too many things at once. So
I'm just messing with you.
go ahead, Linford. What's your question?
Now you're being messy, but that's all right.
Yeah, that's yeah.
Dr. Bakari,
Yes.
good to meet you. I appreciate this. I was actually taking some notes. I was trying to write as fast as I could, but where your slide thing was going. But here's my thing. Two things. Number one, I want to address what we were talking about before, and that is, well, I think you kind of did that. Even in today's environment, in 2025, there's still this stigma. The reason why I was asking that question before was because I know way back in the day, the perception, two things were happening. The perception was if you were seeing a psychologist, that you were crazy. That's number one. Number two, in the Black community, there was this perception that, well, first of all, you didn't have, let's say during my parents' or grandparents' day, you didn't have a bunch of Black folks who were in that field or fields, sociologists, psychologists, or psychiatrists. And so to protect ourselves, even when we had problems, the whole thing was what goes on here doesn't go out of the community or something. I'm paraphrasing. But it seems that that has somewhat changed. It's not 100%, but it's somewhat changed because I'm hearing people talking about, my therapist this, or I have a therapist session. Except whereas back in the day, even when I was coming up in the 70s and 80s, nobody was talking like that. So my question is, um, this thing, would you agree or disagree that there are certain things that affect us all regardless of color, and then there are certain things that affect us specifically? And I think that's why it's important, it's incumbent upon if you're a Black psychologist or a Black psychiatrist, you have a moral obligation to address those things with your Black clients.
Well, so I think that, definitely whether or not a person is Black or not, there are definitely, there's definitely room for just the benefits of addressing mental illness. So I don't think that that's color-based. I think that when it comes to being a Black professional treating mental illness, that just, we still have to deal with what that patient brings us. So that's, and that can be individually based. So some clients may not be open to just where their stress comes from. And we have to talk about kind of, where they see their stress coming from. So it's important for me to kind of meet the client where they are, so to speak, as opposed to assume or to talk about things that they may not readily bring up due to the fact that, it may not be in their realm of awareness.
What was the phone number? Because I know somebody who's youngster, her daughter could use some counseling. So what was because I jotted down psychology and wellness, but I didn't get a chance to write the number down.
Oh, so the phone number for my private practice is 404-609-4912.
404
609
609
4912.
49.
And that may be something that we can put in the chat here.
Okay.
Yeah. So Lyndon hit on a few interesting things. Because you in your presentation talked about because there's a trust factor. And I think when Black folks are looking for therapy, one of the struggles that we tend to find is to find a Black therapist. And you talked about, what did they call it in slavery when people wanted to escape? They even called it some kind of, what did you say, DAP or something?
Yes, they call it drapetomania, actually.
Great domain. Yeah.
Yeah.
So there's the stigma that goes back, all the way back to slavery. And then of course we know that there's a trust factor with, medical doctors. So with psychiatric doctors as well. So do you find that patients are specifically looking for Black doctors? And you being a Black male, I would imagine you're the exception.
Yeah, so I do find that patients, studies show that, when a person is treated by someone of their same ethnic group, there can be a greater sense of connection. But what I would say is that doesn't have to necessarily be present for a person to be able to benefit from talk therapy also. My therapist actually is not African American. And so, but I feel as though my therapist, is able to meet me where I am and to still address some of the aspects of racism and, the stress of being a Black man in this country. Just as well as, an African-American therapist. So it can be great to have that connection, but that connection is not necessary for a person to experience benefit.
Yeah. I would imagine if it's somebody from your same, cultural base, that there are just some things that can be left unsaid. They're just kind of understood.
Yes,
which can also be a problem, because then do we make assumptions that may not be so and not get the therapy that we need? Which leads me to the question that Judy put in the chat. She said, how likely is it that a person can actually self-diagnose themselves to determine that they need to seek help before they actually hit a wall? I would imagine there's a lot of self-diagnosis going on or a lot of denial.
Yeah, I think that, it's definitely possible to kind of check off the boxes. And, I would say that if you are able to check off those boxes, then, it really speaks to importance of making sure that those basic elements of self-care are present in terms of just nutrition, sleep, physical exercise first. And then if, that doesn't do what's needed in order to get to where you want to be, and then that's a good time to kind of then seek medical attention.
We have a hand. Dee, did you want to ask a question? And Dr. Vickerson, if we can if you can peruse the chats too, you might see some stuff that you might
Okay.
want to.
Okay. Yeah. Great.
Dee, you had a question?
Yes. The question for me is, I'm from England, and my question is, how do you get, and I'm speaking, my mum needs therapy. It's a conversation that me and my cousins have had about our parents and grandparents, because a lot of us, like I said, we have therapy when we need it. It's like, to me, it's like going to the dentist. We don't have an issue, but we find that the older generation, and when we try and get our elders, when we see that they are vulnerable and they need that support, when we try and have the conversation about seeking therapy, they're like, oh no, I'm not crazy. And we're like saying, we're not saying that you're crazy. You need support, that you might want to have conversations with somebody that isn't from the family. And like you said, I think it's that thing that they won't speak about personal or family stuff outside of the family, and they keep it to themselves. I see the damage that that does to my mum, and I try so hard, to get her to to get mental health support, but she just won't have it. I mean, she's opened up. I I've created a safe space for her sometimes, and she has, you know, said divulged things to me, and it's made me understand why she has been the way she has, but it's took a long time. I mean, she's in her late 70s now. It took her a long time to feel, I don't know, safe enough to actually talk to me, and I just find it so sad for that generation that is carrying so much trauma.
Yeah, that is a tough one, because, you know, it's difficult to get people to um, do things that we may want them to do. It can be even more difficult to get people to do things in which there are some emotional barriers to, in which there are some barriers to related to stigma, mental illness, and just kind of the way people have been brought up. So those are all of the things that you are working against, so to speak, when you are addressing this topic to her. And so I would say that, softening kind of around it, so to speak, can be an approach. Kind of, if you're able to talk about some of the benefits that you get from talk therapy without it seeming as though you're trying to get her to attend talk therapy, can be an approach to have. Letting her know kind of, you know, when challenges come up for you, that is a safe place for you to go to talk about these issues, can be a way. But it can be very challenging. And so sharing your experience, but also being non-judgmental, and continuing to be caring is going to be the best approach. But there's no simple way of kind of getting someone to start talk therapy when their mind is set that it's not for them, unfortunately.
Dee, thank you for coming. You're from England. Is this your first time with us?
No, I've been with you before. We've just started following each other on LinkedIn because I haven't been for a while because of illness myself. I've got a spinal condition and fibromyalgia, so it's just pain, pain, and pain. And because I'm working, don't ask me how I'm working, but so when I saw this tonight, I thought I've got to attend. I've set my alarm.
Good. I'm glad you're here. And she brings up an interesting point, Dr. Vickerson, about the difference in attitudes about therapy from between the generations. Because I teach,
Yeah.
and I think, as Lyndon was saying, the students all say, "My therapist, my therapist, my therapist." Like it's just like nothing. Like it's almost like the thing to do to have a therapist. Whereas, even when I was young, like if people were in therapy, they didn't tell people. And
Yeah.
even the word crazy, right? The
Yeah.
connotation of that word is just so disturbing, and people don't want to be associated with it. So, are you seeing an influx of younger patients in your practice?
Well, definitely, you know, so since I'm a psychiatrist and don't do
Mm.
therapy as much as I do medication management, um, you know, younger generations tend to be more focused on depression, tends to be more focused on treatment for ADHD and anxiety related symptoms. So that's a lot of the reasons that they come to me, especially, there seem to be a more focus on ADHD causing depression and anxiety. So there was a wave of kind of younger clients looking to be diagnosed with ADHD, um, probably more prevalent than anything else amongst the younger generation.
Gotcha. Yeah, that's interesting because I had put in the chat and we can talk about it some other time. Is there a correlation between ADHD and depression, your lack of interest, enthusiasm, and those? So I think what I
Yeah.
heard you say is maybe kind of sort of.
Yeah, there can be ADHD is not just related to focus or concentration. It's related to the way a person sees themselves in the world. And so they can be at risk for rejection sensitivity if they're not able to kind of keep up with their tasks. That can cause anxiety, it can cause sadness. So it can be a source of mood symptoms, as well as, mood swings, um, as well as issues with focus as well.
Okay. We've got three hands. Rochelle, yours was first. Go ahead, Rochelle, with your question.
Sure, thank you. Thank you for your presentation. So you mentioned ketamine. I am wondering, is that for more extreme or advanced stages of depression? And if so, can you define what that level is?
Yes, so when it comes to, I'll speak about esketamine because I have a little bit more experience with esketamine than any other form of ketamine treatment. So it's actually an FDA approved treatment for treatment-resistant depression. So this is typically when there have been 2 or more antidepressant medications that have failed. So that kind of puts it in a treatment-resistant category because studies show that after that 3rd or 4th antidepressant medication is tried, the chances of those medications being beneficial can decrease to 20 to 30% or so. it's reserved for that, but likely in years to come, some of those restrictions will be decreased. A person can go to a ketamine shop per se, or a psychiatric practice that provides ketamine and pay out of pocket for IV ketamine. So there are less restrictions on IV ketamine. Something else about esketamine is that there's a specific indication for suicidality, which kind of separates it from other medications or forms of treatment. And I've seen it to be helpful in reducing suicidal ideations very quickly. So the benefits are experienced a lot more quickly, and typically with less side effects. And typically when there's a treatment that is shown to produce less side effects, than to have more of a robust benefit per se, then that can put it in the category of a treatment-resistant form of therapy. Yeah.
Deirdre, you had a question?
Yes, I do. Dr. Vickerson, thank you first of all.
Very well.
My question is more of a reflective question. Have you thought very much about possible relationship between individual mental health and community mental health? And if so, if it's something you might consider, do you see it as something that requires perhaps an interdisciplinary approach where psychiatrists, psychologists, we're talking with sociologists, social workers?
Let's see, let me adjust my volume. Do you mind repeating that
Yeah,
question again?
she was muffled.
Okay.
You're a little muffled, Deirdre.
Can you hear me now?
Okay, yes, go ahead.
Okay, is this better?
Yes, this is better.
So Dr. Vickerson, first of all, I want to thank you for the presentation today.
You're very welcome.
And my question is a more of a reflective question. And I'm wondering if you see the relationship between individual mental health and community mental health. And if possible, what kind of dialogue might that involve between disciplines like psychiatry, psychology on the one hand, and social work, sociology on the other?
So let me just address the first part. Yes, there's definitely a connection between individual and community mental health. And I think that, COVID brought that up maybe more so than anything else. It kind of shined a spotlight on that. And a lot of people were, experiencing, significantly increased mental health symptoms, or actually the start of mental health symptoms during COVID, in which there was a lack of connection to others. And that connection to others is important for us to be our best selves. It's important for us to reach our fullest version of ourselves, so to speak. So there's definitely a connection. And when it comes to, the dynamics between psychiatrists and social workers and other healthcare providers, I think that ultimately, being able to appreciate the differences and the different aspects of care that we all provide is super important. And a platform that would make that more interconnected is something that people could benefit from, both professionals and patients as well. So definitely 100%. I remember when I worked with the Grady ACT team, one of the benefits was that I was able to kind of have a dialogue with therapists, social workers, and we were all on the same team and were able to provide that, comprehensive approach. And I was able to gain insight and learn from them just as they were able to learn from me. So there's definitely benefit in that interconnectedness amongst providers.
Thank you.
Yeah.
Miss Bay, you had a question? And Kilthea is next. I thought there was another hand up. Did I lose some? Oh, Kimberly, did I lose you, Kim? Did she leave?
Thank
Go
you.
ahead, Miss Bay.
Yes, thank you. And thank you so much for being in tune to what's going on, to have this forum. And thank you to the doctor. This is extremely important. I've been in therapy for about 10 years now. I had to look at my therapist and say, oh my God, how crazy was I? But it really, people get the impression that, you're walking around with your hair standing on top of your head and talking to yourself and sleeping out on grates. And it's not that at all. You can be just as functional and masking and fitting into society and be dealing with the situation. My situation is depression and a bipolar condition that I really didn't know that I had. But where I'm at now is that I haven't been able to find a medication. I've tried them once or twice, and it just doesn't work for me. And I heard you mention I think it was the ketamine. And the reason why it doesn't work for me, because this whole thing of you got to take it for about a month before it starts kicking in or whatever. But I mean, I know I took something one time and oh my God, that what I took me to a place where it just, I don't ever want to visit that place again. It was like I just was sitting on my sofa and my mind was telling me there's no hope, nothing will ever work, And I was like, oh, wait a minute, hold on a minute. Because I've always been a survivalist, I'm gonna, make it come hell or high water, But the thing about it is that that the medication that you mentioned sound like something that I would be interested in trying. I take the ashwagandha, which helps extremely. Now it keeps me calm. It helps me to concentrate. And don't get me wrong, I am extremely intelligent, extremely resourceful. But this thing, whatever you want to call it, bipolar, depression, it is a daily battle. A daily struggle getting through it each and now I'm at a place where I feel like I'm going back because of the things that are happening in our environment. I'm like worrying about, oh my God, are we going to be shipped off to El Salvador? What's going to happen? And I'm, keeping the news on and losing sleep. All the things that I shouldn't be doing. But I just wanted to say, what are the side effects of the ketamine that you mentioned?
Well, so with esketamine specifically, I can speak to esketamine a little bit more readily because I've used that.
Oh, it's not called ketamine?
Oh, esketamine is a form of ketamine that is provided in a nasal spray. So it's FDA approved. It's covered by insurance. It's a little bit of a safer way to go. And with
Is it over the counter or a prescription?
prescription, 100%. These are controlled medications. So ketamine is going to be a controlled medication, and it's something that you are typically going to experience in the office setting. So it's going to be a controlled way of receiving treatment. Now, some of the side effects for esketamine, and ketamine also are related to respiratory depression. So there's a risk of respiratory depression. In my experience, I've never experienced that, and I've done it multiple times, but they have to tell you all of the potential side effects. So that's important. Every medication, even every supplement, can have some potential side effects. So
yeah, I'm basically a herb oriented, natural. I'm not vegetarian, but close to being vegetarian than not. And I like right now at 70, I don't take any medications, at all. I take my herbs, and so this would be a stretch for me to take this. But what caught me when you were saying it has immediate effects, and what I'm thinking in my mind is that if I could just get out of this funk that I'm in,
yeah,
for a couple of days, a week, and I feel like I can get myself going, because I'm really like don't want to go out now, putting on weight, it's I can feel myself, and even though I do my talk therapy every other week, I'm kind of like losing touch even with my therapist, simply because of environmental things that we're going through.
yeah,
Like this whole race thing that we're going through, and she's Caucasian, and she's been with me 10 years. She's really gotten me to a good place of confidence and so on and so forth. But I just know I'm picking up little trigger words, like if I mention my adult sons or whatever, it seems like she just has a white woman stigma towards, like young Black men. And she has no idea that these young Black men have to live in fear every day of even just walking out the door and feeling like they can get back home safely, So
yeah,
I'm kind of like getting a little disconnect there.
yeah.
Ms. Bay, thank you. I appreciate all your questions, and go ahead and answer Dr. Vickerson, but we got to move on. But one of the things that she is touching on, which somebody put in the chats, and I'm going to try and quote it. But it talks about, I think you even said during your presentation, turn the TV off, turn the TV off.
Yeah, definitely. So it's important to really make sure that you're addressing the basic aspects of self-care, limiting sources of stress, making sure you're putting energy toward getting best quality of sleep, eating healthy foods, limiting social media. Those things are super important in times like this, first of all. And then I would say that you want to, potentially explore other providers for psychotherapy if you don't feel as though you're getting the benefit that you need, which it sounds like that may be the case. But also the thing about what we go through is that it can make us extra sensitive to even things that may potentially fit in the category of discrimination, but may not be, so it can cause us to be more sensitive, more alert, more on edge, and that can cause us to back away from things when it's not necessarily the case. So that's important to keep in mind. If you had a 10-year relationship with this therapist, bringing that up to the therapist and seeing what her response is probably the first place you want to start with that, because your therapist should be open to receiving whatever it is you bring to them. And in terms of, esketamine as a form of treatment, I would say you definitely want to speak with a mental health provider who can talk with you about all of the risks specifically and see if you are an eligible candidate for that. Because part of esketamine is that, people can have a psychoactive experience during their treatment session. So if a person is not open to that or able to, or able to kind of have the capacity to experience that in a controlled environment, then it's something that you likely want to pass on.
Is it addictive?
It is not an addictive medication. It's a controlled medication. You only get it when you are in your treatment session. So it's not something that you take home. It's not something that you have access to in order to get addicted to it. And in my experience, people are not calling the office asking for it. Treatment sessions are scheduled twice a week for the first month, and then once a week for the second month, and then typically every other week for the third month. And the goal is to need it less. And part of that is because it helps to create new neuronal connections. So when you think about it, that's something that you're going to benefit from, so that you don't need the medication as much over time.
Thank you.
You're very welcome.
Thank you, Ms. Bay, and good to hear your voice. Haven't seen you in the last week or so. So back to that question there. So Ms. Cox put in there, is it true that Black folks living in places not exposed to daily white racism are healthier emotionally and physically? And then Kimberly, I got you for the next question. Don't leave me. And Kimberly, Kilpia, Cordelia, and then we're going to let Dr. Vickerson go. So is that true about the racism and all that's happening around us now? It's, Miss Bay indicated some of, we just don't know what's happening. You hear all this stuff coming at you every day. Are we going to be deported? Are we going to be thrown back on plantation? These are very real, I think, concerns for a lot of Black people right now. There's an uncertainty and there's some fear that comes with it. So did you want to address that in any way?
Well, so I am not aware of, I would be interested to know where those places are. And yeah, especially, to be not affected by aspects of white supremacy. So it's possible, but I just have a lack of knowledge about where that would be and what that would be like from my personal experience. That's what I would say to that. Yeah.
It's a utopia. So Ms. Cox, you let us, if anybody out there is living in that environment, let us know, because we're ready to invade your neighborhood.
100%.
But there's something, a lot of people are moving outside the country and people are finding that.
Yes.
So
Yeah.
I don't know that it's here in the,
yeah,
I guess
it's
somewhere
likely
here
less prevalent in certain places, I would say. So yeah.
Yeah. Kimberly, go ahead, and then Kilpia, and then Cordelia, and then the rest of the questions, just put them in the chats, and we'll try and get to them at some other time. Kimberly, go ahead. What's your question, Beck? Yeah. Carnegie.
Is it this Kimberly? Because I didn't have a question.
Carnegie. It's Kim Carnegie. Her hand is up. Kim, and she just keep, I don't know.
She's muted.
Maybe she can't get
Muted.
off mute. All right, so Kim, keep trying. I think you're trying to get off mute, maybe. I'm not sure what's happening there. Kilpia, what's your question, babe?
Hi, thank you, Dr. Vickerson. I had a couple of questions. You mentioned rejection sensitivity. Can you say a little bit more about that?
Yes. So in terms of ADHD, because ADHD has a lot to do with how people see themselves in the world, and how they relate to other people. And oftentimes they can see themselves as being different due to issues that relates to their focus, attention, and concentration. And because of that, that could put them more at risk for rejection sensitivity.
Okay, thank you. And could you talk a little bit about the intersection of autism? You know, the guy that a few people in the news that have been arrested for crimes are now saying that because they're on the spectrum, they should receive certain considerations. Can you talk a little bit about the overlap of autism and mental health?
So autism is a mental health disorder. Autism is, people can have symptoms related to ADHD with autism. Oftentimes with autism, there can be kind of a disconnect in terms of a person's emotions. And they can find themselves being disconnected from others due to how they experience their emotions. Oftentimes, they can seem to be, at times, they can seem to be kind of more childlike if they are adults. And they can have certain types of things that they gravitate towards almost obsessively. So they can tend to want things to be in a certain type of way and have certain emotional disturbances if things aren't that way. Now, they also have gifts, and they can also be very gifted in different areas. And so, that's something that should be highlighted as well. But that's a little bit about autism and the symptoms of autism.
Thank you. My last question is around, are you familiar with, when I was working, I was a program manager for funded programs within the community. And one of our programs was doing work with people who had experienced trauma using, is it rapid eye movement? Are you familiar with that at all?
Yes. So there is EMDR, which
Yes,
is
that's
a
it.
form of therapy. It's eye movement desensitization reprocessing, I believe. And so it's a form of treatment in which I think it's very helpful for treating PTSD, symptoms related to PTSD. It even goes beyond that, and it can target core beliefs that a person may have. And it's a way of almost like doing kind of psychological surgery, so to speak. And it helps to kind of extinguish negative core beliefs or beliefs that a person may have developed as a consequence of trauma. So it can help to reverse those beliefs. And then, there's kind of a change in behavior that occurs once those core beliefs are extinguished or replaced with more accurate beliefs. So that's a little bit about EMDR. Oftentimes in the beginning of EMDR, it can be emotionally intense. and the therapist will typically talk with the client about that. But the benefits can be long lasting and very significant when you think about just the idea of kind of changing core beliefs. That's really powerful. And so I am a strong proponent of EMDR. I think it's a great form of therapy for PTSD or addressing negative core beliefs.
Thank you. I've been retired for some time now. Is that widely used, or has it come into broader use?
Therapists are a little bit more skilled with EMDR, because of the benefits. A lot of them have taken extra coursework or skills training to be able to provide EMDR. And you want to talk with a therapist about, how they do EMDR because because it has become a little bit more popular. So you do want to make sure that that therapist is proficient, so to speak, in EMDR.
Great. Thank you so much.
You're very welcome.
Kimberly, last chance. Are you available? I'm going to try you one more time, and then
can you hear me? I'm sorry about that. I had a connection with my mic. Thanks, Helen.
We hear you. Yes.
Yes, thank you so much for doing the presentation. My question is, and I want to say I apologize for any lag, but my connection is not that great. But I wanted to ask a question. I was a clinician for many years, and I don't want to self-diagnose my daughter. I went through a medical stage 4 cancer treatment, and I noticed that my daughter is having some issues with emotion and depression, and has had issues with depression due to bullyism over a period of time in school. And just the situation that I went through kind of exacerbated the emotional distress. And now she started therapy again, and they put her on medication. I just wanted some advice. How can I support her? She's 19 years old. And to be honest with you, the situation affected all of my children, but my 19-year-old really is dealing with a lot. She's diagnosed with mood disorder and a couple other things as well. I'm skeptical with some of the medications because one of them actually caused side effects before, and now she's on sleeping medication and a couple of things. So how can I support her, and what can I do to just help her maintain that medication management?
Well, I think that, definitely there's likely a certain level of involvement that she's comfortable with you having. I would say, really looking to kind of allow her to kind of have her experience, but for you to be involved as much as she allows you to be involved is going to be important, likely, so that there's not this push-pull dynamic. And then as long as she is open to you kind of, providing input, that can be helpful. Being present during her mental health, her psychiatric sessions can be helpful. I think it's great when parents are present because children at 19, are not always able to see themselves as others see them. And so being able to provide that level of support by providing a different source of history can be very helpful. But sometimes, I've seen where clients were, maybe they had a negative experience with one medication at one time, and they just kind of weren't ready for the medication. Maybe they had a heightened level of anxiety or whatever it may be the case. And then they took that medication at a later date and they had a totally different experience. So, that's something to keep in mind as well. Sleep is super important too. And so, if a person is not sleeping, what are the harms of them not sleeping? And so oftentimes it's about finding, a medication that helps with sleep that provides the least amount of side effects in order to make sure that good quality sleep is achieved, or at least putting as much energy towards that as possible. So those would be my thoughts to what you've stated.
Thank you so much. I
You're very welcome.
appreciate it.
You're very welcome.
Thank you. Thank you, Kim. And Ms. McKnight, you'll be our last question. Cordelia? Is she still with us? Cordelia, are you still there?
Hi, can you hear me?
Yes, I can hear you.
Yeah.
Okay, this is very similar to the previous question. Thank you, Dr. Vickerson. You've been very informative. Can you speak to the diagnosis of bipolar disorder and schizophrenia? And what do you recommend as far as aside from medication for individuals that experience psychosis and mania? And do you find that there is an increase in this disorder?
So what I recommend for bipolar and schizophrenia is consistent medical follow-up. So being involved, with psychiatric care, having a psychiatrist, making regularly scheduled visits is going to be important to make sure that the treatment is doing what we want it to do, to monitor for potential side effects, to also have blood work drawn because certain medications can increase the risk of having an elevated cholesterol, blood sugar. So those things are super important. There's no one size fits all in terms of medication management for bipolar disorder or schizophrenia. Bipolar disorder, if a person has ever known a person to have true mania, then it really underscores the importance for there to be medication on board to prevent that from occurring. Because it's something that can cause a person to be arrested, hospitalized, especially if they are Black in America. It's something that, police, different members of society are not well equipped, or not all well equipped in dealing with. And there's a significant change in how a person is when they're having an episode compared to how they are when they are well managed. At one time, bipolar disorder was considered the CEO disease because people would be very elevated, and a lot of people in top positions would have this and lose everything when they have an episode. So management is super important. When it comes to schizophrenia, I think that, early treatment is best. Research across the board will say that early treatment, addressing it when it's early, is super, super important. I worked at Grady and we worked with the ACT team, and basically ACT team treatment is dedicated for patients who have 3 or more psychiatric hospitalizations within the 12-month period. So that can be, so the importance of that is you have hospital services that actually go out to that person's home to help them with management. Vitamin deficiency can be a part of the propensity for schizophrenia. So making sure that, blood work is taken. It's important to, typically when a person has a first episode of psychosis, they have a head imaging done because that's something that needs to be ruled out. Even though it's rare, it's important for it to be ruled out. So those are some of the things that I say are important when those illnesses have been formally diagnosed. Now, some will say that person has bipolar disorder when they just have mood swings. So that's important to differentiate from as well.
Okay, thank you.
You're very welcome.
Good questions, good session. There's still some questions in the chat, but I am respectful of your time. And we have Lynn. Lynn, are you still with us? We have Lynn who's ready to come on and talk to us. So I wanted to, before we sign off with you, Dr. Vickerson, do you have any closing thoughts or words that you want to share with us? I've put your contact information in the chats again. Please remember that Dr. Vickerson is taking, I don't know if he's taking patients, but he does see patients who are not in Atlanta. So you can see him, what do they call it? Telepathic, what do they call it?
Yeah,
Over
telemedicine, telehealth. So I'm starting my private practice. I'm just leaving Mindful Health Solutions. So my private practice is Optimum Life Wellness. You can reach me at support@optimumlw.com. Once again, that's support@optimumlw.com. Also, contact number is 404-609-4912. It's been a pleasure. And
Do you take insurance?
I do take insurance, yes.
Say that again, Dr. Vickerson. I'm typing it in. You said support.
Yes, that's support. I can type it in at optimumlw.com.
Is that an email address you're giving us?
Yes, that is.
Okay. Support at Optimum. You can type it in because you can do it quicker than me.
Okay. Okay.
Yeah, so that's the other thing. One of the questions that I had, how different, I know for therapy, it's kind of difficult to get insurance companies to cover this kind of care. Is that the same for psychiatry, or is it easier to obtain psychiatry?
I'm sorry.
Fewer options?
Say the first part of that again.
So how difficult is it to get your insurance company to cover? Do they tend to cover psychiatric services? I know they have.
Yes.
It's hard to get for therapy.
They do often cover for psychiatric services. Most major insurance providers cover or provide coverage for psychiatric services.
That's important. I'm looking for Lynn. I know she's still here. Lynn.
I'd like to say something. I'd like to say, Dr. Vickerson, thank you so much for doing this.
Okay.
When I asked him, I knew his schedule was pretty tight. And I also wanted to know, will you come speak at NAMI for me next? Because I think that that's something that they need to hear about. And I put the NAMI information in the chat, Helen. They have information, free brochures,
100%.
a lot of different information.
Is that you? I'm not sure who's talking. Is that you, Adrian?
It's Adrian. Yeah, I put the NAMI information in the chat because I work with NAMI Cobb, and I had asked Dr. Vickerson to come and speak to them as well. So there's a new thing called Sharing Hope, where they're talking about African Americans and our mental health journey. And it's a new brochure that just came out. I'll be going around to the churches talking and trying to get more people involved in therapy. Thanks so much, Dr. Vickerson.
Thank you very much.
Absolutely. Thank you so much. I appreciate you coming. I hope that you'll come again. And folks, if you didn't grab his contact information, you can just reach out to me and I'll be sure and pass it on to you. I hope that everybody found this conversation. There's no question that we found it informative. So I don't know if you're going to hang around for the skincare, but just in case he isn't, can you all unmute and thank him and show him some love for coming to spend this time with us today?
Thank
you.
Thank
you so much.
Very informative.
Dr. Vickerson. Awesome.
Thank you. Thank you.
Beautiful. Beautiful.
Really?
All righty. Thank you, Doc. And we now have Lynn, who's going to talk to us about skincare, another kind of self-care, right? Because Yeah, so let me introduce Lynn is not only a Mary Kay person, she's an attorney and she's been on she went on one of our trips with us down to the Goa. So some of you might have met her when we went to Goa. But I'm going to turn it over to you, Lynn, and I hope that you all did the skincare analysis that she dropped in the that she sent out in the email.
That's right. Well, thank you so much, Helen, for having me. And thank you all for hanging on for another like 5 minutes. This has been a great presentation. As they say, self-care is the best care. So first of all, as you know, Mary Kay has been around for 63 years, and she focused on enriching women's lives, but most importantly, taking care of your skin. So if you don't know about Mary Kay, it's a skincare line first and foremost, and we are number one in the world, 2 years consecutively. So some people, I actually sent messages privately to let them know who I was and my contact information. So if you have to get off, I'll just tell you now, you can certainly reach me at 301-661-0010. So I have two of my consultants on the line. So if one of them could put that in the chat, I'd greatly appreciate it. Again, my number is 301-661-0010. So that you can have more of a personalized skincare checkup from the neck up. So again, thank you, Helen, for having me. I just want to go over just a few questions. First of all, I will ask you if you have dry skin, just raise your hand or put it in the chat because we have a product for you. Or if you have oily skin, raise your hand or put it in the chat because we have a different product line for you as well. And I want to emphasize that our products are gender neutral. So it's not just for the men, it's not just for the women, it's for everyone. So again, two questions, dry or oily. And of course, if you participate, you'll get a prize just to give you an incentive to participate. So the first thing again, dry skin or oily skin. Second thing, thank you. Second thing we want to talk about, and usually we have a skin analyzer, which I will show you. I'll put it in the chat, but we also have what's called a profile card. So we're kind of doing it this way so you can kind of see it. There we go. So I'm just going to read the few questions. Oily skin or dry skin. Second concern is eyes. Most times we get puffiness underneath our eyes because our skin is our largest organ out of the entire body. And that's why we need to preserve the youthful look, take care of our skin. And then the second issue is our eyes. We have a lot of little skin underneath the eyes, which is why there's dark circles. Why is there puffiness? Because the skin is thinner around our eyes. Therefore, we should use the ring finger because it has the least amount of muscle. And you just tap underneath the eye, y'all. No rubbing, no rubbing. Just simply tap your eye cream underneath the eye and it will reduce the puffiness. So I'm just going to show you some of our favorite items for the eyes because I know people are like, well, what do you have for the eyes? So we have what's called our cooling eye gel. Ta-da. And this is like the cucumbers you see people putting on their eyes. And it really does work. And you can actually keep it in the refrigerator. And again, you take your ring finger and just dap it underneath and it will reduce the puffiness. Trust me, it works. Of course, our products are money back guarantee, but certainly we can, as I say, it's one of our good housekeeping seal of approval. So definitely that's the cooling eye gel. So if one of my assistants could put that in the chat, I'd appreciate it. The second eye product that we have is what's called our instant puffiness reducer. Instant puffiness reducer is this is the product, right? And you just need a rice granule, just a very, very little. So I'll just show you how it looks, right? And I'll show you. There you go. Kind of go this way. And you just, again, dap it underneath the eye with the ring finger. It lasts for 6 hours and will retract that puffiness instantly. That's why it's called Instant Puffiness Reducer. Yes, it really does work. And then our last eye product that a lot of people, I'm sure you know about, is what's called our hydrogel patch. Patch you just underneath your eyes. Yes, men can use it too because we know they have puffiness. They don't want to tell you, but they do. And so there how it looks, right? It has a little spatula. So you take the little spatula and then you take off the products. There are 60 of them, one for each eye. And you keep 10, 15 minutes and then dissolve it or rub it into the remaining product underneath your eye. And that's it. And those are our top eye products in addition to our eye cream. All right. I know y'all talked about, so what do you use for dry skin? What do you use for oily skin? Well, this one is it is skin neutral and it is called our Cadillac set because we're known for the pink Cadillac. So what is included is our cleanser. So get the box open. Ta-da. Very good. Ta-da, isn't it beautiful? And just in time for Mother's Day, yes, we have 20% off for all those mothers. Or if you have a mother or want to be a mother or used to be a mother, you can get a discount. Don't worry, we got you. So this is our cleanser. So use that first. Always cleanse your face. Then we have our day cream. Our day cream has SPF, sun protection factor of 30. So even if you have melanin in your skin, you need some protection. All right. And then at night, we have the night cream that has retinol in it, encapsulated retinol to restore the collagen back to our skin. Because as we continue to mature, not age, we lose the collagen. And then last but not least, two things actually. We have the eye cream that I was talking about. So I'll show you what it looks like. Ta-da! And it has a nice titanium tip. The titanium tip will reduce that puffiness as well. You too can keep this in the refrigerator for cooling devices. So those boxers, they have puffy eyes. They use this as well. So you just put it underneath both eyes, rub it on the top and bottom, and it will reduce your puffiness. And then the last product in this set is what we call Spanx in a bottle. For those of us who wear Spanx, the guys don't, but they still need a serum. This is what we call our volume lifting serum. And it really does reduce restore the elasticity back to your neck, no more turkey neck, as well as on your face. So this is our Cadillac set. All right. And if you want to know how much it is, put it in the chat and I'll answer questions after. We only have a few more minutes because I know everyone has to go, including me. So the last three things that we have is called our supplements. So this is what's called our dynamic wrinkle filler. And it really does take care of your expression lines on your forehead and on the sides of your face. No more Botox, no more syringe. All we need is this dynamic wrinkle filler. It really does reduce the expression lines, etc. 76%. So no more syringe. They say throw out your syringe and put on the cream. And if you need a booster, we have what's called the line reducer. And again, it helps with these expression lines here as well as your turkey neck. Booster is great, this line reducer. Our second is our hydrator. So if you have dry skin, this is your game changer. And we have two more boosters. The one booster we have, is the brightener. I love the brightener. So we want to remove the dead skin cells that are invisible. That's what this brightener does. And it pairs well with what we call our replenishing serum, C and E. All right, we got two more products and then we're going to be done. We have what's called our roll-up bag. Ta-da! I know it's a lot. It's a roll-up bag. And what does it have? It has, can you see it? It has 4 pockets. So I'm just going to go over 2 pockets because we've gone over most of it already. Ta-da! So this is what we call our Time Wise. Our Time Wise is for oily or dry skin. That's why I asked you to put in the chat if you have oily skin or dry skin. You may have seen on Good Morning America that one of our best sellers is our Night Recovery. Let me show you that. Our Night Recovery has encapsulated retinol in it as well, vitamin D and C. And I have the Day Defender, but I think the other roll-up bag has the Night Defender. And that actually has vitamin D, C, and E. Yes, antioxidants, best housekeeping seal of approval. But bottom line is, for our Time Wise, you do the same thing as the Cadillac set. You have your cleanser, and you have your moisturizer, and you have your day cream and your night cream. So anyone 30 and below should be using our Time Wise. Anyone 30 and up should be using our Time Wise repair set because it has the collagen, it has the night cream in it, which has the resveratrol, and it it restores the collagen back into it. There we go. Bingo. So let's see. So again, with this Time Wise, you would use your cleanser, your moisturizer. It has an eye cream as well, and it has a night cream. And last but not least, if you have oily skin, these are some of our supplements. Ta-da! Most important supplement that helps with oily skin is our clay mask. And you're like, Lynn, you're going too fast. Don't worry, I put it in the chat. This is our charcoal mask. The charcoal mask is for oily skin. The clay mask is for dry skin. So if you have oily skin, you want to use this charcoal mask. So if you're interested in this, let me know. And if you again have dry skin, you want to use the clay mask. If you need something for your feet, as most of us do, we have what's called our Mint Bliss. Ta-da! And this is going to be our last product, and then I'll take any questions. So our Mint Bliss really does help with swelling. It reduces the swelling on your feet as well as your legs. And so we use that. And then, of course, if you need a stone to reduce some of the bruises, you can use this as well. But bottom line is, this is one of our best sellers. So at this time, I'll take questions. Come off of mute if you have a question or raise your hand. And those who raise your hand will definitely get a prize. So let's see. Any questions?
What about people with normal skin? I don't have oily or dry skin. I'm kind of lucky, I guess.
Right. No, then you would use our Time Wise. Our Time Wise here. Here we go. Mhm. So if you have normal to dry skin, then you would have, this one has the purple on the back, which means that it's for oily skin. But if you have normal to dry skin, it has a pink line. So that means that you would just use this cleanser and your moisturizer. Is there a question? Or is somebody, oh, I
Yeah,
see your hand raised. Miss
and I'm
Judy, go
loving
ahead.
the stuff for the chin. Go ahead, Judy. What you got, Judy?
I think we were sent a link to do an analysis.
Yes, yes.
No, if I do that analysis, is my face going into some database?
Not at all. Not at all. It's just for you. It's just for you. If you email it to me, then I'll be able to assess it for you. But if you click like details, it'll give you the details. So I'm going to see if I can drop it in the chat, or if one of my consultants are on and they can drop it, that'll be helpful. But yes, the skin analyzer actually assesses your skin and then recommends the products that Mary Kay would recommend for you. It is amazing. I see another hand raised. You could just go off of me. I think it's Miss Kimberly.
Yes.
Yes, hi. My skin is doing from treatments, doing weird things. Sometimes it's mostly oily, sometimes it's dry. Do you have a combination system for sometimes, it goes from one aspect to the next?
Yes. I would recommend again the time wise, because the time wise with the pink line says normal to dry. So if yours is predominantly normal, meaning like it's not dry and it's not oily, then that would be the formula you would use. If it's typically dry, then certainly you would use that, meaning we have one that's for combination to oily, so you would use that one. Or if it's just dry, then you would use the normal to dry time wise. And I put the skin analyzer in the chat. So if you all can retrieve that, and we can do that quickly, or if you want to do it on your own and get back with me, that's fine. Where did you see it in the chat? Is it in the chat? I'll try to copy it. Any other questions?
And if you don't see it in the chat, it is in the email or the text message or the text message that you got from me. So if you click on there, you'll see where you can do your skin. And then there's also a button on there that says share. And if you share it, so when they share it, Lynn, they
It
share
just
it
goes to me. Yes, they can
through
text
your
it to
email.
me. Correct. Yes.
So with your phone number, with the phone
Yes,
number that you
exactly. Right.
Yeah. Any other questions for Lynn? Black women, what do they say?
Black don't crack.
Black don't
But we
crack.
sag, yes, but we sag. That's the problem. People think because we have melanin in our skin that we don't, that we don't get wrinkles. It takes us a long time to get there. However, when we get there, it's there, and we want to make sure that we want to just preserve the youthful look, but more importantly, put the elasticity back into our skin. And Mary Kay does that with this time-wise volume lifting serum. It's amazing.
And how long have you been doing Mary Kay?
Doing Mary Kay about 4 years. I was a full-time military, retired, and then I moved on to practice law. And then I decided, I see all these beautiful women. I need to make sure I'm taking care of my skin, because we just don't think, because again, we don't see the wrinkles. But you'll see as you continue to mature, you'll see the sagging and you'll see your eyes get puffy. And it's just genetics, as they say, as we continue to mature, not age. Thank you. We continue to, we want to preserve the youthful look. That's the bottom line. We want to preserve the youthful look, and we're blessed to have melanin in our skin, so we don't look our age for a while, but we need to make sure we take preventative measures. And that's why Mary Kay has established the company, to make sure that women they don't, say you don't have to tell your age and you don't have to look it either. And so our products really, really work. So proud to say #1 for 2 years consecutively. So I'm just curious, how many actually have used the product before? Either raise your hand or put it in the chat. Just curious. And if so, what is your favorite product? Curious about that too. Oh, quite a few. Very good, very good, very good. Miss Patricia, do you have a favorite product that you use? Miss, I don't know if she come off of mute. Miss Jones. Oh, you're still muted. Sorry, you're still muted.
I like the cleanser. I've been using Mary Kay for a long time.
Okay,
And
okay.
I don't use it faithfully, but now that I heard you talk, I'm a
Yes,
keep up my
indeed.
routine. But I watch these South Korean movies, And I
Yes.
just noticed they have they have such beautiful skin, these actors and
Yes.
actresses, and you always see them
Yes.
cleansing their face. They don't use Mary Kay, or what do they use?
Well, I'm not sure honestly what they use, but I know that everybody's looking for this glow and this glass. They're talking about this glass look, and that is one of our best products as well. It's our nourishing oil. The nourishing oil you can use on your fingers, you can use on your hair, and certainly you can use on your face, even if you have oily skin. It really does hydrate. That's why it's called a nourishing oil, because it really does hydrate your skin. So even if you have oily skin, you're not going to walk around looking, shiny, as we say, or greasy, because it's going to soak into your skin and give the skin the nourishment that it needs. And this is one of our products. It's called nourishing oil. So yes, that's that glass look that everybody says, I want that glass look. What's that Korean glass look? They're focusing on a nourishing oil. They also have different additives, like we have the biocellular mask, skin mask, etc., gel mask. That's one of our common masks that we have. But what's giving this glow, this glass look, is that nourishing oil. That's the game changer. That's the new thing. As they say, what's the new thing? The new thing is our nourishing oil. Were you all able to download the Skin Analyzer app? Just curious. I know it was sent via email and text, but I tried to put it in the chat as well. I'm going to send it to you, Helen, and maybe you can put it in the chat for them if that's okay. That way they can all pull it, because just to make it easier for them. I know your phone is off, but if you could turn it on.
Oh, you're sending it to my phone? Oh,
Yeah,
I
so
need
that you
to.
could just copy it and drop it in the chat for
I
them.
do bad at. I can't do. I believe it or not.
Okay.
I stink at
Okay.
that.
Okay, that's
Because I already
okay.
have it on my
Ladies,
phone. Yeah.
okay, I'll
I'll
send
send
it to
it out. I'll
Judy. I
send it
think
out
Judy.
again. When I send out the video, I'll send out the chat. I mean
Okay.
the link.
The
And one
link.
was
Okay.
for an iPhone and the other one was for an
For
Android, ladies.
Android.
And of
Yes.
course, you can always reach out directly to Lynn and get that information.
Right.
But anyway, let me ask you this before we sign off. Does Mary Kay offer
Yeah.
a line exclusive for African American skin?
They don't, to be honest with you, because again, skin is skin. And so what we try to do is that why that skin analyzer app is so important, because most people just have oily skin or they have dry skin. And then we go from there in terms of if you have acne, then we have a product for that. It's actually our Clear Proof. I didn't show that today. But we really first and foremost, that skin analyzer app is so important. And the profile app or profile sheet is so important, because it tells us what your skincare concerns are. That's why I asked at the outset, do you have oily skin? Do you have eye skin? Do you have, puffy eyes? Do you have concerns about fine lines and wrinkles? Because we have a deep wrinkle filler so that your face can get rid of that roadmap. My mother used to say, got my face looking like a roadmap. Our deep wrinkle filler is game changer. And same thing with expression lines or people, Botox. No, we have the deep dynamic wrinkle limiter that actually will reduce those lines and expressions on our face. So there's no product that's geared exclusively for African American or for Asian or for Indian or for Jews, et cetera, et cetera. Skin is skin. Then when we segue to the glamour, of course, we have a product line that focuses on, the type of are you, do you have CC cream called a complexion correction, and that goes for, do you have deep, like my color is deep, or do you have light to medium or medium to deep or very light? So we do have those that are geared towards your complexion, but as it pertains to skincare, period, we don't distinguish it from one ethnicity to another. But when it comes to the color and foundation, yes, we do. And we also have the app that's called Mirror Me app that I think I sent you as well. So I'm gonna try to put that in the chat. But that you all will love, because again, it allows you to try before you buy. Like, what would I look like in brown lipstick? What would I look like in red lipstick? What about a foundation? I'm not sure if I'm deep or very deep or medium light or light to medium. If you click the link and it literally applies on your face, and it's just amazing. I was going to see if I can share my screen so you
Somebody has a question and we're going to wrap this up.
can see it
In the
and
chat,
giggle.
do you
Okay,
have,
thank you.
what do you have for hands? They're saying. I think that was the question that
Yes,
I
yes,
saw.
yes. We have exactly. We have what's called a satin hand set, and that comes with our scrub as well as our softener. In fact, I have it right here. This is our scrub, and this is our softener. And then this is our hand cream. And it's fragrance free or white tea and citrus. And it retails for $38. So if you're interested in that, let me know. And of course, everything is 20% off because you all stayed with me. So I definitely want to get your contact information. If Helen has it, then I can get it from her. But if you feel comfortable, you can certainly put it in the chat and I can get you all a discount. I'm so excited that you stayed. Kudos. See, it pays to stay. You get the discounts and you get personalized service because I certainly would love to service you. As they say, to preserve the youthful look because we're forever 21.
You guys do business with her, let me know so she can give a little heads up or a little piece of something to when Black women
I
together. We
will.
appreciate it.
I will. Absolutely. Can I just share my screen so you can see the Mirror Me app real quick? Because you all are
Very
going to be
quick.
impressed. Okay, very quickly. Okay, here we go. Share screen. So much fun. Modern technology. Don't you love it? Screen. Okay, can you see my screen? Let me know when you can see it.
No, we see you.
Okay, it says
Oh, there it is.
Okay, perfect.
Okay.
So now I'm going to go to the Mirror Me app. Can you see the Mirror Me app?
Yes.
Can you see the
Yes.
apps?
Yes.
Okay.
Yes.
Okay, perfect. All right, well, I just want to show you. Okay, then you go to live camera. Live camera. Perfect. Now you see me. Hi.
Yes.
And so at the top, right. So it takes a selfie and then you click your glamour. And it's going to show you different camera shots. You see at the bottom? You see at the bottom, it's different glamour shots. You see that?
Yes. I do.
So I'm going to take my glasses off so you can see the effect. So when you click the pictures, it actually will apply to your lips. So you see now my lips are dark cherry. Can you see my lips?
Yeah. Yeah.
Isn't that cool? I love it. So, because sometimes we're just not sure, like, do I want a red or do I want a really red? This is Rockstar Red. Or do I want a
Cool.
burgundy? It is so awesome. And so you just pick the color. And at least, now I have lashes on. I look sugar sharp, y'all. You can't tell me nothing. What? So I'm ready to go out to an evening cocktail. Just kidding. But nevertheless, this is a way with Mary Kay Mirror Me app. It allows you to try before you buy, which I love. Because sometimes we just don't want to make the purchase, but we want to see what it looks like. And so this allows you to try before you buy, which is amazing. And then our last one, which I want to show you, is our the skin analyzer app. Just real quickly. Can you see that?
Yes, we see it.
Okay. So and then you select which one you are, dry, oily, normal, or combination. So I would just say normal and get started. So now it's going to do a selfie of you. It's going to be a little challenging because you're supposed to do it without any. You as close to it as possible, and it's a selfie, right? It's not going to do it because, again, I have the makeup on. But bottom line is, this is a great way to assess your skin, and which I love, of course, because, again, we don't want to upsell, but it gives you a nice assessment of your skin. It might work, might even work. Work. I don't think it's going to because of the makeup, but that's
I
okay.
did that.
Bottom line is, it works. Oh, you did? Okay, you got results. Well, you should share it with us. All right, very
it's
good.
on my
Let's see
phone.
if we have any. Yes.
But it was pretty
Okay,
cool
well, you have to
because then
share
it
it with
told
us.
you,
It just tells you what it
what
is.
your skin.
Exactly. It tells you what your skin needs, which is fantastic. Stop share. So thank you, ladies, for your time. I appreciate you so much. Thank you, Helen, for having me. And I hope that we're able to get together soon.
Thank you.
Absolutely.
Very good.
Absolutely.
Yes, I
Wendy
appreciate your
Brown, is she
time.
still
So
with
I don't
you?
have your number.
Okay.
Who
No,
is
go
this?
ahead. No, go ahead.
No, I'm gonna
If
say
you
thank
don't,
you
so
again. Thank you again for your time. You're welcome.
chat. Put your number in the chat again,
Okay,
Lynn,
very
just so
good.
people will have it.
Yes, I will. Exactly.
So on that
And
note,
then
I'm going to say farewell. This evening was about, our care inside and out. And I think we neglect both sometimes. Certainly the internal side of us, we don't pay enough attention to. And during these trying times, we need to be sure that we're taking care of ourselves. Black women were always taking care of other people, but this is a time when we must be taking care of ourselves. If you need help, don't be afraid or ashamed or whatever to ask for it. If it's not help through a therapist, Black women, we're strong for other people. We can be strong for each other. So, but I didn't get him to focus on as much as I wanted to. It was just so much information. Like, how do we know? What signs are we looking for in people to know that they need help? And then how do we extend that help? But certainly follow up with Dr. Vickerson. NAMI is a national. Kilthea and Michelle have done work with us before, so I think a lot of people have come on and talked to us about NAMI. So even if you're not in the Atlanta area, you can just Google them and find your local chapter. Kilthea, their services are free, aren't they?
Yes, they are. They're a great support system. And of course, the 988 number for suicide or support. And if you need support, you can you can text 988 for support.
Surely. So on that note, ladies, I love you all. I don't know that we'll be here next weekend. I'm thinking we won't. Normally for Mother's Day, I come together for those of us who don't have mothers who just want a place to commune. But I'm packing to move, guys. So I think I'll probably be buried in boxes and stuff next week. So the following week, though, we have an excellent program. Leslie Moran is going to come on and talk to us about how we're coping in our work lives through all of this. Many of us are in these uncertain situations and don't know if you got a job today or tomorrow. And if you have a job today, even if you're not with the government, don't be so sure. So let's be proactive. She's going to talk to us about what we can do to protect ourselves in the workplace. And I can't remember something else I have at the end of the month, but we're rocking and rolling. And it's Memorial Day. So it's just a lot happening. And I am leaving Florida. Do I look excited about it?
You're moving?
Yes, I'm getting out of here.
Wait a minute.
So yeah.
You're in Florida now. Where are you moving to?
I'm initially out the country for just a little while. I'll do a little country hopping and then I'll come back and deal with life. But I still be with you guys. We'll still be meeting on Sundays. We'll probably still do some trips over the, next few months or what have you. But right now I'm just kind of low key and, I'm functioning, guys. That's all I can tell you. So this talk was, very important for me as well. So on that note, I'm going to say this has been another wonderful Sunday and thank you for gathering. And I'm going to stop recording. And if you want to stick around for a few minutes, that's cool. But I need to go sit in the jacuzzi because my back is hurting. Getting old. Not cool.
Thank you again, Ms.
Thank you all.
Oh, yes, it was fun.
Yes.
Please put your phone in the chat or please contact me.
Thank
Wait to
you.
reach out. Welcome.
Yeah.
Thank you all. Thank you.
Thank you all. Thank you. Thank you.
Thank you.
Thank you
Thank you,
as always.
Helen.
Absolutely. Absolutely.
Wow.
So,
All right.
Helen, you're going to be traveling by yourself?